Hi everyone, we are here with Dr. Landon Oka. He is a general dentist. He will be speaking to us today about his dental experiences. If you have any questions, please put them in the YouTube live chat and we will go over them after the presentation. Dr. Oka, you may start when you are ready.
Cool. How's it going, everybody? I'm Dr. Landon Oka. I'm a general dentist out in Mililani, Hawaii. I've been practicing for about almost 2 years now. The background of this slide is from where I went to school, technically not really, but from IU, Indiana University. Let's see, next slide. So this is my background info. So I'm a general dentist. I received my undergraduate degree in biomedical science from Oregon State University. So that's OSU right in the background there, Weatherford Hall. I got my DDS, like I said, from Indiana, and I'm practicing out in Mililani. Let's see. So starting off with some study tips for school. So, important for school, especially in a professional program, is to figure out what works best for you. A lot of time in undergrad is spent, studying and whatnot, but the schedule of undergrad is a lot more loose, meaning you have more free time than when you're in a professional program. So your studying when you go to school is going to have to be a lot more efficient. So for me, I figured out what worked best for me when I was in undergrad, and then it had to kind of intensify when I went to dental school. So it's kind of a time-consuming process for me to study personally. I retain things best by writing things out, drawing them out, and kind of rewriting notes here and there too, just for repetition's sake. But it is important. It is important to develop a balanced routine, so you give yourself enough time to study, enough time to work out and exercise, and then enough time to hang out with friends and just in general, just enjoy yourself a little bit too, because you don't want to only be caught up in doing everything for school. That's how a lot of people get burnt out, and then they start off very strong in the program, and then they start to fizzle out, and then eventually they get the burnout, and then it gets very hard for them to keep up with their schoolwork. Another great thing to do, I personally love getting to study groups with people. It's always fun to learn other people's perspectives on how to look at it. Something that you guys are studying. It might give you a new perspective, better understanding. And then also it's good to just be able to talk with people and joke around and kind of lighten up the mood and relax your mind while you're studying as well. Let's see, next one. So community service is something heavily looked at by dental schools. It looks really good on your resume. It shows that you have value serving your community and other people, which is basically the entire healthcare field is all about that, right? So whether you're going into med school or dental school, it never hurts to have more community service on there. So it shows that you're capable of compassion and empathy for other people, and that you're willing to give your time to help other people in need as well. I don't know about you, but I wouldn't be too comfortable going to see a doctor or a dentist that doesn't really care about people. I'd be pretty uncomfortable with that. So IU gives you a lot of opportunities to volunteer through the dental school. So one thing I was personally a part of is a student outreach clinic. I'm not too sure if they're doing that still, but when I was there, it was a student-run organization. It was multidisciplinary, so we had the medical, we had dental, social work, law, pharmacy, all in one clinic kind of setting, and did it a couple Saturdays a month. And basically, when you're in the dental program, you're doing fillings, extractions, cleanings. And then before I left, we got a grant to do dentures and root canals and crowns and stuff. So it's awesome. Another opportunity that the school gives is the Give Kids a Smile program. That's probably one of the more popular ones for people to do. I know we got it out here in Hawaii as well. Give kids a smile is basically you just do some exams, you hang out with the kids, teach them about their teeth and proper oral health care, just generally setting them up for a better oral health future. Mission of Mercy is another popular one, kind of nationwide. So that one is more clinic involved. You do a lot more of fillings, extractions, root canals, etc. But it's a great opportunity to get a lot of hours of community service and really give back to the community around you. And then I have a picture here on this slide from South Dakota. This is from the Rosebud Reservation. We did a dental service mission trip out to South Dakota. So that's me and a bunch of other people from dental school. But we're just there for a week during spring break. They also do a week in summer, and you just do dental work on the reservation, hang out. And it's awesome because you get to understand a different way of life, new perspectives from, the native people. And it's really actually a great opportunity. Let's see, this next one is, so I had people ask me about this before. So choosing a specialty. A lot of people will either come in not knowing anything about the specialties or knowing a lot about one and wanting to specialize in just one. Most of the time, the motivation for choosing a specialty is going to be how much money you make because of it. So ortho's a real popular one. A lot of people think they want to do oral surgery. But the thing that they don't tell you is that those programs are really highly selective. You got to be like real top of your class kind of person. So if you're thinking you want to go that route, I would highly encourage getting some shadowing with them, or at least talking with them and developing a relationship with a specialist. They can teach you and kind of tell you what everything's about. Personally, I shadowed with pretty much every specialty except pros and pedo. So like the guys that do dentures and extensive restorative cases, and then kids dentists. Those are the two I didn't really do. But I did a lot of shadowing with my oral surgeon because he's right downstairs. And through that experience, I was able to get access to hospital and watch a couple of procedures there, and discovered that I didn't really have an affinity for that. So I love what I do as a general dentist. So second bullet point here, the hardest thing about specializing for most people is just maintaining a high GPA all through dental school. Grades are weighed pretty heavily. Some programs also have you take another test as well. So it really depends what kind of program you're looking at, what schools you're looking at as well. So that's kind of the tougher part. So personally, I'm still considering specializing as an endodontist, which they do root canals. My reasoning behind that is not because I'm going to make more money or anything. I just kind of really like the people at my school. I thought they were awesome, super cool people. They lived a great lifestyle of, giving back to the community and giving back time to the school as well. They were pretty much working as part-time faculty for not too much money. They just enjoyed interacting with the students and teaching them what they knew, and I thought that was super cool. So I'm still thinking about that. Nothing set in stone just yet. Let's see. Next slide here. So typical day for me. So I work part-time in private practice, and I'm part-time in a corporate office. So what are most patients concerned about? It varies what patients come in to see you for as a general dentist, because we see everything from people that just need cleanings to people that need extensive dental work, and people that just come in and they want to whiten their teeth. So it always depends. So a lot of people come in with the complaint, oh, this tooth is sore, or I'm interested in whitening my teeth. How do I go about doing that? So it's just it's never the same thing twice in a couple hours, and it keeps you on your toes. It keeps your mind going, keeps your mind working. So it's actually pretty fun. So what is the toughest part about proposing treatment plans to people? Most of the time, it's just teaching the patient and understanding. So in Latin, the word doctor translates to teacher. And, I think it's very important to take that role seriously as a teacher, because there's not too many other good resources for our patients to learn proper oral health care, why they're getting cavities, how to properly take care of their cavities, and when to get things done. For most people, it's just gonna, or for most patients, it's just gonna be a concern about, oh, why is it so expensive? And I think to counteract that, it's more important to teach them why they need to get it done and what can happen if they neglect it, and then how to take care of it going forward. So for me, I haven't had too many issues with people, not wanting to do the treatment because, oh, it's too much. When you break it down and explain to them, like, it's really important to take care of it like this and get this done now, because if we do sit on this and wait, what could happen is something worse. You can experience more pain and stuff like that. So for my typical day at private practice, so that's job number one. So I start around 8 a.m. I see anywhere from 3 to 5 patients in the morning. I go till 1 p.m. usually. So lunch is about 1 to 2. And then I close out the afternoon seeing another 3 to 5 patients. Monday and Tuesday end around 5 p.m. Wednesday I'll end around 7. So at that office, I'm working pretty much by myself. I don't have an assistant or hygienist. So I do everything from the cleanings, extractions, the CAD cam, CEREC, crown stuff. So there's a picture in the middle here. But, like root canals and all that good stuff. But yeah, like I said, I work with no assistants or hygienists. So a lot of my schedule is booked up with like recare appointments, cleanings, etc. But I see that as a positive that, I have the time to reconnect with patients and really get to know who they are. So I like that part about it. Job number 2, so that's where I work at a corporate office 2 days a week. So typically we start around 8, take a lunch 12 to 1, and end around 5. So I see almost double the patients there, because at that office I also do hygiene exams, so that counts as seeing a patient as well. Things are a little more fast-paced because I do have an assistant there, but there's no CEREC, so we're not doing like same-day crown procedures or anything like that. It's traditional, take an impression, send it to a lab, and et cetera, et cetera. But yeah, so I don't do any cleanings at the second office because they have hygienists to do that there. And I just go in at the end to do the exam, check for any cavities, talk to the patient, and then they're set to go. So we're getting into the cases here. So this is my case number 1. So kind of how I break down these cases is I'll start at my treatment planning appointment. So this is at the office number 1, so my private practice place. So when I bring them in for the cleaning exam, I kind of do a look over at all the teeth there, kind of see what's wrong, treatment plan, and document. This tooth in particular is a upper right first molar. So for US people, it's tooth number 3. For international would be 1-6. So maxillary first molar. This patient was in his mid-60s, no pre-existing medical conditions, and his chief complaint was he had some sensitivity on this tooth. So if you look at the tooth kind of in the middle of the picture on the right, that's the one we're talking about. It's got a big silver amalgam filling in there. And so I looked at it, I use loupes. So it's basically like magnifying glasses on your eyes. My magnification is at 5.5. So when I look at this tooth, it's zoomed in. I can see it almost as big as you can see it in this picture here. So I noticed that there's some fracture lines going through the tooth from the front of the tooth, which is toward the front of the mouth, so the mesial, all the way to the distal. So it goes underneath the amalgam on the back side as well. And this amalgam is just huge. Like I can tell it's already undermining a lot of tooth structure. The distal lingual cusp is already kind of taken out with some of that amalgam. So in my head, when I'm treatment planning this, I'm already thinking, there's cracks here, there's a big filling. More than likely, the tooth is going to need some kind of full coverage restoration. So crown, overlay, onlay, that's all kind of what we're thinking. So behind there is a PFM crown, so porcelain fused to metal. That one had a pre-existing root canal, and it's just not a great looking crown. It looks kind of beat up. So I'll talk about that later. So treatment staging. So we do the exam, x-rays, cleaning, everything usually in the first appointment. So a second appointment is when they come in for the treatment. So we get in with the local anesthesia. So for this particular case, I chose to go with Articaine. Articaine 4%. So it's got a higher concentration, smaller molecule size. So it diffuses through the bone and tissues a lot easier. And with the epinephrine, it stays in the same area for a lot longer, which is nice because this guy's going to get a same day crown. So I wanted to be numb the entire appointment. So this green thing that you're looking at is a rubber dam. Rubber dam gives us isolation from saliva, blood, anything that might contaminate the tooth. So it looks funny, but does a lot of good stuff. It also prevents them from aspirating, so swallowing any of the filling material that might fly out as well. So this guy in particular, the crown on the back tooth actually came off from the clamp. So it was poorly bonded. It was probably going to come off at some point in time, and it decided to come off in the dentist's office, which is like the perfect place for it to pop off because I just put it right back on. So this is the case continued. So this is a deconstruction of the tooth. So, I already knew that the cusps were undermined, so I was already going to go ahead and reduce the cusps. So I take out the old filling, kind of assess the remaining structure, reduce the cusp, find the crack. So if you look toward the front of the tooth, there's a little divot, like a little pothole. And what that is called a crack dissection. So when you find a crack, I usually drop in there and I'll try to find the end of it and infiltrate it with resin composite material. And then on the back side, the margin of the tooth, so where the crown would meet the tooth, dropped a little bit below the gum line. So I did something called a margin elevation, which you do with composite material and good bonding agent. And it allows you to bring your margin from an unfavorable subgingival margin, which means below the gums, to a nice supragingival, easy to capture and easy to restore margin. So this is kind of the process here. The scan and the milling is of a total different crown, but that's just for, imaging's sake. So here we have the dentins all sealed up. So the dentin's the inner structure of the tooth, right below the enamel. So I do something called immediate dentin sealing. It improves your bond strength. It seals the dentin, so you get a lot less post-op sensitivity in the tooth. I scan the tooth with the CEREC scanner. CEREC is our CAD/CAM technology, so computer-aided design and computer-aided manufacturing. CAD/CAM. So you scan it in, and if you look on the left here, there's a picture of a scan. The middle picture is of a milling of a crown, and then the one on the right side in that 3-picture set is the overlay design. So I hardly prep traditional crown preps anymore. I do mostly these overlay designs. It's a lot more conservative on tooth structure. And instead of relying on retention on the tooth, you're relying on the bonding to your materials. So that's where that IDS comes into play. So let's see, we'll go to the next one. So this is kind of our finishing up of the restoration. So if you look on the top picture, that is the cementation of it. So the white stuff over the tooth is Teflon tape. There's a little bit of super floss in there between the teeth, and that's a little frizzy white thing. And then the stuff squishing out from the crown is restorative composite material, which I use instead of regular cements. The properties of it are a lot better, more wear resistant, bond strength is higher. And then when I cement with heated composite, so it reduces polymerization shrinkage. So when you cure a composite, it shrinks. When it's heated up, it doesn't shrink as much, and it maintains your bonds pretty well. So I clear up the excess, polish it up, and then you get the picture in the bottom there where the crown's nice and cemented. After you're done with this, you take off the clamp, you take off the rubber dam, check the bite, and then they're usually good to go. Okay, so this is case number 2. This tooth was a nub. So patient was a mid-40s male, no pre-existing medical conditions. His chief complaint was that his crown broke when he was eating gummy bears, of course, but it wasn't in any pain. So the assessment of the tooth here, it's tooth number 29, so lower right, second premolar. International classification of the tooth would be, I think it's 4-5. So quadrant 4, fifth one in the back. This tooth, it wasn't, when I looked at it, it didn't look too good. It was pretty much fractured to the gum line, previous root canal. But luckily for him, none of it was below the gum. So I told him, if I can get a clamp on this thing, we can probably restore it. So I get my rubber dam set up. You see the isolation. I got the dam inverted around all the teeth. And that little nub is nice and isolated. So I only have 2 pictures from this particular case. Here is kind of the breakdown. So I talked with the patient about, ultimately this is kind of going to be a toss-up of 50-50 whether this is going to stay in really well or not. So I talked to him about this class that I'm taking. I'm taking an advanced adhesion biomimetic dentistry kind of course. And biomimetics focuses on restoring the tooth kind of back to how it was before, utilizing materials to recreate bond strengths of enamel to dentin, et cetera, et cetera. So I talked to him and I said, because this is so 50-50 up in the air, whether it's going to last or not, let's give it a shot. I'll do it for free and we'll just kind of watch it and see if it works. So he's like, he's a young guy. So he's like, okay, I'm down. I'll try it out. And so how we did this, I did a Gaugate's block, which is a lower right inferior alveolar nerve block technique. Placed the rubber dam. For this particular block, I used lidocaine 2%, larger molecule size. According to research, less chance of nerve paresthesia with that. And I was going to build this thing up in composite, so I didn't need him to be numb quite as long as the last person. So basically what I did is I removed any of the soft carious tooth structure. So anything that was decayed, take it out, air braid the tooth in bond and do my IDS. And then same thing, I didn't get a picture of it, but I put Teflon over the adjacent teeth again. And then I put Teflon tape over the stump of the tooth so I can build up on that and get a good intimate fit, polish it up and everything before I cement it down. So this is our final result here in this picture that is completely handmade out of composite by me. I was pretty stoked with how it turned out. Looking at the end, it looked pretty good. But yeah, it was really nice. I did it an indirect way to reduce the polymerization shrinkage, and then cemented this with restorative composite. And I saw him a couple weeks ago, and this fabricated crown is still in place. He said he hasn't had any problems with it so far. So far, so good. And then, so this is our start and this is our finished result. Picture quality is not super great because I'm taking it all on my phone. Okay. So this is a kind of cool one too. So this is a direct composite case. The other 2 were indirect techniques. So this is a 21-year-old female, non-contributory medical history. So nothing's going on with her. She had a lot of decay and just history of not taking very good care of her teeth. So you can tell that the cavities here are pretty nice sized cavities. This is actually after I prepped it out and took out the decay. So she had primary caries, which means there was no existing restoration on tooth 29 and 30. So lower right second premolar and lower right first molar. So 4, 5, and 4, 6. So these would be restored with direct composite utilizing biomimetic bonding technique. So it's pretty simple for this kind of thing. You would go in, find the decay in the exam. So the patient, hey, we got to do this filling. So what you do, same thing, right Gaugate's block, this one, I wanted her to be numb, not as long. So I went with lidocaine again. Lidocaine 2%. Rubber dam, isolate, prep the teeth, take out the decay, and then you go through the bonding protocol. So you apply a primer, a bond, light care, and then you restart with composite. And this is the result here. So it looks just like regular tooth structure. So this does take a little bit more time and a lot more technique sensitive than smashing a silver filling in there. But looking at something like this, it makes me a lot happier to do something like this. And when I do a filling like this, I do what's called an incremental fill. It reduces the polymerization stress, which, long term keeps the bonds a lot better, but it also looks a lot better too. Some people just kind of slap in composite and call it good. I like to add these little details and stuff and try to make it look as good as I possibly can. Growing up, my mom always said, put things back how you found them or better than you found them. So that's kind of my goal when I do my dentistry, is put it back as good or better than when I found it. So that is it, I think. So this is my closing statement here. So parting thoughts, committing yourself to the dental field is a huge decision. It takes a lot of time, a lot of money. School's not cheap. And, you're going to have to work really hard, and you're going to have to be fully dedicated to it. If you're kind of getting cold feet, I would not recommend going into it just yet. As much as I loved my classmates, through the process of school, we lost, I think, about 5 or 6 from our class alone, just from failing out. Some of them got to join up the class below us. Some of them had to get excused from the school and then reapply later on. So, it is a commitment. And if you're not willing to make the full commitment, I wouldn't recommend doing it. But it is amazing if you're all in, if you're all about it. It's a great profession. For dental school, applying to school, it doesn't matter what major you are, where you went to school, or how old you are. And like it says here, I had classmates who were like over 40 when we started, and I was 21 when we started. I had a classmate that was 20. She turned 21 our first year of dental school. So, it doesn't matter the age. I've had classmates that are business majors, finance and stuff. Somebody was, I forget what it was, like hospitality major. So the major also doesn't matter. It just matters whether or not you get the prereqs done. But, dentistry is an awesome, awesome profession. There aren't too many other careers in the healthcare field that you get to work with your hands, and you get to really restore things and see immediate results. So it's super awesome. And the relationships that you form is really unique, almost to dentistry only. There's a lot of variety in what you can do as a general practitioner, and it's all packed into one thing. So it's super awesome. And, this last sentence here, you can really actually put a smile on someone's face and make a huge difference in their life. I've seen it firsthand, whether it be giving someone their first pair of dentures after they've been toothless or they've had busted teeth their whole life. And when you see the smile on their face and you know that their life has changed and they're so happy and grateful for what you've done, it's more rewarding than any kind of cash payout could ever be. Yeah. So let's see. Yeah. So Q&A.
Thank you so much for your presentation. We do have a couple questions. So our first question is, how did you prepare for the DAT?
How did I prepare for the DAT? This is one of those things where I'm going to say, do what I say, not as I do. I personally only studied for the DAT for a month. I would recommend taking a lot more time for studying. I had 2 different books. So I had Kaplan book, and then I forget what the other book I had. But I was fortunate enough where I was working as a dental assistant over summer that I was taking the DAT. And in between patients, my boss would force me to study for it. And he said, oh, here's some practice tests. I got this for you because I want you to do well on your exam. And I was like, okay, cool, thank you so much. But not everybody's going to be fortunate in that sense. So give yourself more time to study. Set aside time each day leading up to really get into it. There's all kinds of forums that you can join. People will post information about what topics are weighed more heavily. And yeah, I mean, the PAT portion, the perceptual ability, I got lucky in that it really clicked for me, so I didn't have to study as hard. But if there's stuff on the exam that is on the exam and you have a history of struggling with, for me that was probably the math section. But if you're going to struggle in an area, do what you can to increase your results, to improve your results. It's not a cheap test, so you don't want to have to take it more than one time if you can avoid it.
Thank you. The next question is, do you recommend research?
Yeah, I mean, if you can get in research labs, it always looks great. I think everybody at Indiana University undergrad, if you're applying to dental school, they make you do research in some capacity. It looks great. If you can get published, it looks even better. And if you're going to specialize, they're going to want to see that you've done research before, because the dental specialties are master's programs, so you have to do a research project for the most part. But yeah, it just looks a lot better. It looks like you've got a little more direction on your resume.
Okay. What got you into dentistry?
What got me into dentistry? So when I was 5 years old, I told my mom that I either wanted to be a dentist, a lawyer, or a garbage truck driver. So, obviously the garbage truck driver thing didn't stick very well with her. But, it came down to lawyer and dentist, and my uncle is a lawyer. And I watched him for a couple of days, and I didn't like the work. I thought it was too strenuous. There's too much reading, and it didn't seem like something that was going to satisfy me. So when I was in high school, I started shadowing with our family dentist, and I ended up working as an assistant for him too. But just working with him, he said his goal was to try to convince me not to do it. And at the end of the thing, whatever, if he still wasn't able to convince me to not do it, then it was the right field for me. So he really tried to teach me everything he could about teeth, about procedures. And I think just being able to work with him helped my passion for the field grow. And that's what really made me want to do it. And then just seeing, like the relationship he's built with his patients, and, all the families that come in and they're so happy to see him. I'm like, man, I want that same thing. I think that's super cool.
Yeah. What advice can you give us as pre-dental students?
What advice? I would say, don't get too caught up in studying. Studying is really, really important, but you want to have that life experience too. Because, I mean, you can look as good as you want to on paper with your GPA, test scores, and everything. But, they when they bring you in for interviews, they want to see that, you're a normal person too. They want to see that you're going to be able to make relationships with the patients, with your classmates. And, you're not going to be like just this weird person that's going to like sit someone down, pull their tooth, and then kick them out. They want you to be able to have stuff to talk about, have conversations with the patients. And really, part of dentistry is being able to form those relationships. And if you can show them that you're really good at that, as well as, you're studious and you're a good applicant, then it improves your chances. Yeah.
Okay. What kind of procedures do you typically deal with?
I would say like 80% of what I do is like restorative dentistry. So crowns, fillings, stuff like that, where you're just drilling the tooth and doing restorations, fixing cavities. So that's most of what I do. I'll do a good amount of extractions too. The root canals, if I was full time at an office, the root canals would be a lot easier for me to do. But because I'm only kind of part-time at both, it's hard to have it scheduled where it's, I've got a reasonable amount of time, because usually I'm booked out too far to give them a spot for the root canal. So I like doing them. It's just hard to get the time to do it. But yeah, that's kind
Um,
of most of what I do.
I think this is our last question. How did COVID affect your typical day as a dentist?
Ooh, that's a good question. Um, Initially, it affected it a lot. With more PPE, we had to put up more barriers, air filters, improve our aerosol reduction technique and stuff. So initially, it was kind of a hassle. We also had to kind of space out patients more, so you see less patients. And then, there's just those patients that are kind of paranoid about it, and I don't blame them at all, but they would call, make their appointment, and then kind of back out at the last second, be like, COVID, I don't want to come in. So it was, at first, it was pretty stressful because, the case counts are rising here, but now they've kind of leveled off and they've actually gone way down. So now we're kind of back to normal. We still kind of maintain the same amount of PPE, which the amount of PPE didn't really change all that much other than wearing a N95 mask now. So that makes it a little bit tougher, but um, now we're kind of almost back to normal. So it's not too much different now. But yeah, initially it was pretty rough.
Okay, I think that's all with our questions. Thank you so much for presenting with us today. It means a lot. We're gonna be putting up the quiz in our chat and in our link tree later today.